These are all the side effects which are encountered with the ACE inhibitors. Next, moving on to the next question, that is patient on losartan now diagnosed with the HbA1c 8 grams. What is the alternative drugs to losartan? Please remember, if the patient requires the alternative drug to losartan, which will going to help the diabetic individuals in controlling their or regulating their blood sugar levels, you need to remember 3 drugs, that is still. So ARBs which are having peroxisome proliferator activated receptor gamma activity. They are TIL. T stands for telmisartan. I stands for irbesartan, and L stands for losartan. So these are the drugs which can be used. So these peroxisome proliferator activated receptors gamma will going to regulate the blood sugar levels, and also it will decrease the insulin resistance. Apart from that, these PPR gamma will also be increasing the nitric oxide synthesis by activating the endothelial nitric oxide synthesis. Thereby there will be increase in the vasodilation, and also it reduces the oxidative stress, and also it reduces the vascular inflammation. So these are the advantages of giving ARBs in case of diabetic individuals. So if losartan has to be changed, you can go with telmisartan. Next, coming to the question, that is, a known alcoholic patient presented with seizure and he was in unconscious state. Which of the following is an immediate management of this patient? So here the case is about the delirium tremors. So under delirium tremors, you can go for thiamine. You can go for the diazepam, and you can go for haloperidol. So option here can be C, A, as well as you can go with flupentexol also. So here they are given 1, 3 is the option. The correct option will be 1 and 3. So naltrexone, where this naltrexone is used? Naltrexone is used for decreasing the decreasing the opioid de-addiction, for decreasing the alcohol craving, and third is to as a anti-obesity drugs. Next, which receptor is responsible for meiosis? So meiosis is mainly due to the circular muscle fibers. This is the iris muscle. So circular muscle fibers will contain M3 receptors. Activation of these M3 receptors will going to cause constriction of the pupil, which is the meiosis. The option will be the M3. So which is the receptor which is present on the radial muscle fibers? It is alpha 1. So activation of these alpha 1 will lead to contraction of the radial muscle fibers, lead to dilatation of the pupil, which is called as mydriasis. So this is called as meiosis. Next question, what is the sequence of drugs which are used in the status asthmaticus? So this was some of the people said this was the question, this question was asked. So if they asked, initially you need to go for hydrocortisone hemisuccinate. First is the hydrocortisone hemisuccinate 100 milligram IV. It can be repeated further. Next, go with the nebulized salbutamol, nebulized salbutamol, as well as the ipratropium bromide. Then you give with the high flow oxygen supply. Then you can go with the salbutamol as well as the terbutalin can be injected through IM or subcutaneous. So if the nebulized salbutamol or ipratropium are not effective, you can add on with this salbutamol and terbutalin IM or the subcutaneous injections. Next you can go with the intubation as well as mechanical ventilation. Next step is to you need to correct the dehydration by giving the saline, and also you need to take care of the acidosis. So here you need to give a saline, normal saline. Acidosis can be treated by sodium bicarbonate. Then you can also give aminofillins. So this is the sequence of drugs which are used in the treatment of status asthmaticus. Okay, and next coming to the other question, that is finasteride mechanism of action was asked. So it is a direct question. So finasteride is a 5-alpha reductase inhibitor. So coming to the next question, that is hypolipidemic drugs which are preferred in diabetics, So which is the hypolipidemic drugs which are preferred in the diabetics? So as you can see, the use of the statins will going to increase the risk of diabetes. But there is one novel drug from the fibrates, that is saroglitazar. Please remember, it is saroglitazar, which is a novel drug which belongs to the fibrates. So these has been approved. By India, for the treatment of diabetic dyslipidemia, as well as hypertriglyceridemia. So these has been approved in the treatment of diabetic dyslipidemia as well as the diabetic hypertriglyceridemia. So here the option could be, initially you can start with these statins, but if the statins are if they are not more helpful, you need to go for fibrates. So if the question had any drug names, then the fibrates will be the answer. Or in terms of, if initially you can start with the statins if they are under low risk of diabetes. If already is a diabetic, it is better to go with the novel drug fibrates, that is the saroglitazar, which has been approved by India for the treatment of diabetic dyslipidemia as well as diabetic hypertriglyceridemia. So the answer would be fibrates. So next, coming to the next question. So this was the incomplete question which we gathered from the different platforms. So metronidazole side effect was asked. So they said that metronidazole side effect were asked with a picture of hand was shown. So usually this metronidazole will going to cause side effects like the metallic taste, metallic taste, metallic taste. It can cause glossitis. It can cause dry mouth. It can cause dry mouth, and it can impair the consciousness, impair the concentration. Concentration ability can be lost. It can lead to allergic reactions. Allergic reactions like urticaria, flushing, itching, heat itching, and it can also lead to fixed drug eruptions. Fixed drug eruptions. If it is used for a prolonged duration, so the long-term side effects, prolonged adverse drug reactions will be the peripheral neuropathy. It can increase the risk of seizures. It can cause leukopenia, and also it can cause thrombophlebitis. So if anybody gets the option, please comment it in the comment box so that we can complete this question. So next, coming to the other questions, like alkalization of the urine is done for overdosage of. So this has been covered already. So alkalization of the urine is done for overdosage of the weak acidic drugs. So for the weak basic drugs, you need to go for acidification. You need to go for acidification of urine. So next, match the following. The teratogenic effects of the respective drugs has to be matched. So lithium will going to cause Epstein anomaly. Thalidomide will cause phocomelia. Warfarin will cause hypoplasia of nose. Chloramphenicol will cause gray baby syndrome. And there is one more syndrome, that is yellow baby syndrome, which is caused by cotrimoxazole. That is the Kernicterus yellow baby syndrome. So there is one more syndrome, that is Redman syndrome, which is caused by vancomycin. You should remember vancomycin causes Redman syndrome. And next, moving on to the next question. So which of the following treatment option is utilized in salicylate poisoning? Salicylate is the weak acidic drug. You need to alkalize what? Alkalize the urine. So this is the answer. So how do you do alkalization? It can be done by adding sodium bicarbonate, sodium citrate, or you can use carbonic anhydrase inhibitors. Next, coming to the medical termination of pregnancy modality is not used in first trimester of pregnancy. So option is mifepristone, misoprostol, dilatation and curettage, manual aspiration, and ethacridine instillation in amniotic fluid. So please remember, mifepristone, misoprostol, dilatation curettage, and manual aspiration, they are done in the first. They are done in the first trimester of pregnancy, whereas the ethacridine extraamniotic instillation will be done in the second trimester. Along with that, saline intraamniotic instillation can be done as well as the high doses of oxytocin can be given during second trimester of pregnancy. So which is the modality which is not used in first trimester of pregnancy? It is the ethacridine instillation. So next, coming to the next question, that is, in this phase 4 to 5 patients are taken. Investigator tries to find efficacy at multiple sites. Both patient as well as the investigator do not know about the drug given. So if the patient and investigator doesn't know, it is the double blinded study, and they are doing in multiple center. So these will go in favor of actually the phase 3. But only the worrying part is they are done in 4 to 5 patient itself. But it can be correlated. In general, the phase 3 will be done in the large population, especially in the patients. It may include around 500 to 5,000. But here in the question they are given 4 to 5 patient. So in terms of if they are doing a trial for any anti-cancer drugs, in such cases the patient population or sample of the patient will be low. So very minimal patient will be taken. So here the answer goes with phase 3. Next, you should also know that uh, some of them said that the question regarding the opioid was also asked regarding the tolerance associated with the opioids. So please remember, opioid will develop tolerance to all except for tolerance does not develop for MCC. That is, M stands for meiosis, C stands for convulsion, C stands for constipation. So opioid can develop tolerance to all other manifestations except for the MCC, that is meiosis, convulsion and the constipation. Next, coming to the 39th question. So which of the following is safe plasma concentration for acute prophylaxis of lithium? So when you are using a lithium, so for prophylaxis and the acute treatment of mania, so the safe range will be 0.8 to 1 and here 1 to 1.5. So if it exceeds more than 1.5, so it will lead to toxicity. Toxic symptoms will be manifested. So the safe plasma concentration for acute prophylaxis will be, cannot use 2 to 3, you cannot use 0.623 because it is more than 1.5. Again, it is more than 1.5. So the option will be the first option. So next, which of the following is a novel antidepressant? Again, this is the direct question. The novel antidepressant is the velazodone. So the other antidepressants are like, we have a serotonin receptor antagonist like trazodone, nefazodone, as well as velazodone. So these are the antipsychotics. As a nepin is a atypical antipsychotic. So here the answer is novel antidepressant is the velazodone. Next, coming to the antidepressant which is contraindicated in angle closure glaucoma. Please remember, there are two main tricyclic antidepressants which are contraindicated for use in the patient who are having angle closure glaucoma. Those are the protriptyline and amitriptyline. So the answer will be the amitriptyline. So these sertraline, fluvoxamine, mirtazapine, their they will not cause any anticholinergic effect. Why this protriptyline and amitriptyline has been uh, contraindicated in patients who are having angle closure glaucoma means basically they are having potent muscarinic receptor blocking action, thereby it will lead to mydriasis, which can cause further increase in the intraocular pressure by blocking the iridocorneal angle for aqueous outflow. So next, which of the following is true about the graph? So this was the graph which was shown. So drug A, drug B, and drug C. So this is the efficacy. This is the potency, x and y axis. So which one will be the right answer here? So here A is more potent than B. Potency wise, A is more potent than B. Efficacy wise, A and B are similar. Whereas what is the efficacy of C? Efficacy of C is less than B as well as A. What about the potency? A is more potent than B and B is more potent than C. So here B is more potent than A is the wrong answer. So here A is more efficacious than B. They are equally efficacious. A and B are agonist. Yes, A and B are agonist. So these B can be a competitive antagonist. By increasing the concentration of the agonist, you will get the same efficacy similar to that of the drug A, but the potency has changed. So A and B are agonist. C is competitive antagonist. If C was competitive antagonist, it would have shown the graph like this, the rightward shift. So here the efficacy has decreased. So there is a downward fall of drug B response. So it is not a competitive antagonist. It is a non-competitive type of antagonist. So here the right answer will be the C, that is A and B are agonist. So next, the patient is on losartan presented with HbA1c more than 8 grams. Which of the following should be preferred in this patient as an alternative to losartan? So already we have discussed. So alternative to losartan, especially in case of diabetic individuals, you need to select the ARBs associated with PPAR gamma activating action. So those are TIL. So telmisartan, irbesartan, and losartan. So instead of this losartan, you can go with the telmisartan. These are also safer in diabetics. They regulate the blood sugar levels, blood glucose levels. They decrease the insulin resistance, and also they are longer acting drugs. Next, moving on to the next question, which of the following is false about disulfiram? So disulfiram, let us see the statements. So it does not reduce alcohol craving. So yes, it does not reduce the alcohol craving. Next is it acts by inhibiting alcohol dehydrogenase. So alcohol dehydrogenase is the fomepizole. Fomepizole is a drug which inhibits alcohol dehydrogenase, but disulfiram will inhibit the aldehyde, aldehyde, dehydrogenase, aldehyde, dehydrogenase. The correct answer here is the false statement about disulfiram is the option B. So disulfiram causes accumulation of acetaldehyde leading to nausea and vomiting. Yes, the harmful effect of acetaldehyde will be the nausea, vomiting, etc. So they are used in ethanol de-addiction. Yes, they are used in ethanol de-addiction. Ethanol de-addiction. So atropine cannot be used. So please remember, atropine is an antimuscarinic drug. It can be used in corneal ulcer, acute anterior uveitis, malignant glaucoma, but not in case of angle closure glaucoma. So the right answer will be, the correct answer is angle closure glaucoma. If you use this in angle closure glaucoma, what will happen is there will be increased in the intraocular pressure due to the blockage of the iridocorneal angle. So atropine is contraindicated in case of angle closure glaucoma. Please remember this. So which of the following is used topically in the management of glaucoma? So if this question is like this, or if it was, which of the following carbonic anhydrase inhibitor are used topically in the treatment of glaucoma? If they had asked regarding carbonic anhydrase inhibitor, then the correct answer will be dorzolamide. So the correct answer will be the dorzolamide and brinzolamide. Dorzolamide and brinzolamide. These two drugs are given topically. Whereas there are other carbonic anhydrase inhibitor which are given in the form of oral route. They are acetazolamide and methazolamide. So if they had asked regarding only the topical drug with respect to carbonic anhydrase inhibitor, you need to go with the dorzolamide. So next question is, a pregnant female is exposed to diethyl silvestrol. So what will be the teratogenic effect expected in the child, especially in the female child? So it is also a direct question. So the answer will be the clear cell adenocarcinoma of vagina. So next, which of the following is false about memantine? So this question has been asked in your exams, and we had got many various uh, options, as well as the framing of the question was a little bit different when we extracted this question. So in some of them said, they asked regarding only the true statement about memantine, and some of them said only they asked regarding the false statement about the memantine. So true is memantine is a NMDA receptor blocker. It is glutamate receptor blocker. It is used as monotherapy. Yes, it can be used as monotherapy, or it can be combined also with anticholinesterase. It is used in moderate to severe diseases. Yes, it is correct. It is used in moderate to severe diseases of Alzheimer's disease. Maintenance therapy, 15 milligram to 20 milligram. So this is the wrong answer. Initially we will start with 5 milligram. So this will be the right answer. So next question, all of the following are seen more with the carbamazepine than oxcarbazepine, except carbamazepine will have rashes, thrombocytopenia, as well as increase in the liver enzyme, that is gamma glutamyl transferase enzyme, except for dilutional hyponatremia, which are more seen with the oxcarbazepine, which is not seen with the carbamazepine. So the right answer will be the except. They asked except. They have asked except. So you should be very careful. That is dilutional hyponatremia. So next comes again the black hyperpigmentation or the palm and sole is caused by. So please remember, there will be confusion between the zidovudine and the emtricitabine. The zidovudine, please remember, it causes nail pigmentation, whereas emtricitabine will cause skin pigmentation. So here the answer will be the emtricitabine. Skin pigmentation can occur over palm as well as sole. So again, this was asked and we got a various forms of question. So clinical trials involving 3 to 4 hospitals conducting a study on a new drug with only 4 to 5 patients. So if it were to be an anti-cancer drug under clinical trial, so there can be a chances of including only the lesser peoples. So if it is done in a 3 to 4 hospital, it is a multi-centric study. And if it is was a double blind, if the patient and the investigator doesn't know what they are administering, double blinding, so then the answer goes for the phase 3. And again there was one more question which asked with respect to the new drug registration. So usually new drug registration will be done after phase 3 completion, but before marketing. That means to say before the phase 4 clinical trial, that is post marketing surveillance. So next question they had asked is sildenafil acts by mainly sildenafil is a selective phosphodiesterase 5 inhibitor. Thereby it increases the cyclic GMP levels and it enhances the activity of nitric oxide. Thereby it causes vasodilation of the corpora cavernosum, thereby erection. They are used in the treatment of erectile dysfunction as well as in the pulmonary hypertension. Thank you.